Welcome to this tutorial video. So please, before we begin, make sure that you hit that subscription button so that you don't miss out on other upcoming educational videos. So for those that maybe have not watched any of my videos yet, I'll just introduce myself once again. I'm Mr. Tembo from Step Up Academy. Of course, I take students through a number of courses. I think some of you that have been following for some time, you've been able to see that I do upload, tutorial videos from different courses. So to start with, I would like to mention that this particular platform, of course, is mainly for students that are specializing in the following programs. That is Bachelor of Science in Nursing, Midwifery, Public Health Nursing, Mental Health Nursing, and Oncology Nursing. But I should make mention to say, even for those that are, of course, in other fields to do with maybe, for example, pharmacy or medicine, they can benefit from these videos because basically the concepts are the same behind these different things that we talk about. So as you can see on the screen, today we'll be looking at cell injury and cell death. So this is a course that you find in pathology, and for those that, of course, are doing this course, you are well aware that this course is divided into general pathology as well as systemic pathology. And then what we're looking at right now is part of general pathology. It's one of the introductory topics that you find in general pathology. So in class, I taught you about cellular adaptation. That's where, let me just give you a recap. That's where we talked about how a cell normally responds when it has been stressed. Okay? We talked about different ways, in which a cell responds when it has been exposed to, strenuous stimuli. For example, we talked about hyperplasia, we talked about hypertrophy, atrophy, metaplasia, dysplasia. We talked about those different terms. And just to give you a recap, I'll just run you through what we talked about so that we can, perfectly connect to what we're talking about today. So we said, for example, if at all, one of the ways that a cell can, adapt when it has been stressed is through what we call hyperplasia, where we said, for example, this is when now a cell has to increase in number. For example, if you're talking about the endometrial lining having to proliferate during the menstrual cycle, that's an example of what we call physiological hyperplasia, because high levels of estrogen, of course, being distributed to that particular uterus in ladies, of course, you find that it stimulates the proliferation of the endometrial lining that brings about, of course, it thickening and everything during the menstrual cycle. That's just one of the examples. And then we also talked about hypertrophy, for example, where we say that this is just basically the increase in the cell size and not the increase in number of the cell. We talked about, for example, a man who is going for gym, of course, since they're exposing those cells to strenuous activities, too much blood flow to those particular cells, you find that their myocytes, of course, they're going to, or their myofibrils, they're going to increase because of the stress. So that was what we looked at when we were talking about cellular adaptation. Now, interestingly, today we'll be looking at cell injury and cell death. As a student that is studying these courses that programs that I've mentioned, it's very, very important that you understand how cell death and cell injury takes place, because most of the diseases that you see with your naked eyes, most of the symptoms or the syndromes that you get to see is as a result of cell injury and cell death. So if you look at the two terms, there's cell injury one, then there's cell death. So the injury is going to come in, and then looking at the severity of this injury we're going to talk about, it will depend if at all this cell is going to die or not. So that's what we're going to be looking at. So remember, when we looked at different ways in which a cell can adapt, we want to understand now, what if this cell fails to adapt? Then what happens next? Is the cell going to be injured? And if at all it has been injured, will this cell end up dying or not? That's what we want to look at or understand in this general pathology topic. Okay? Now, interestingly, let me just show you a very, very interesting picture here. You can see there's this particular foot here. Of course, you can see that this is basically necrosis. There's some sort of necrotic nature that is taking place in this foot. And then you can even see that this hand of this particular person is kind of, it's inflamed, it has swelled. I think you can even see It's almost looking like gangrene that side. Okay? I think you can even see some element of pus being produced. What I want you students to understand is that whatsoever you are seeing, these presentations, these clinical features that you are seeing are a result of cell injury that resulted into cell death. Because if you look at your skin, for example, look at yourself, you find that your skin is looking very smooth. Everything is okay. Why? Because your cells have not been injured and they have not died. That's why you're looking like that. But if at all your cells were to be injured and they end up dying, definitely you would also look like this. So as we explore the topic, we'll get to look at what happens, what makes the cells, of course, start presenting these particular symptoms that we are seeing here. All right. We are saying that also in the recap, remember, when I introduced cellular adaptation, I talked about how a normal cell looks like, for example. So you have got a normal cell here under homeostasis, simply meaning that things are normal here. Everything is under normal circumstances. You're going to have a normal cell. If this cell has been exposed to stress, the stresses can be maybe too much smoke, it can be maybe, less activity in the body, it can be maybe, stimulation by hormone, okay? Or maybe neurotransmitters, depending with whatsoever stress. It could maybe too much activity or exercises, whatsoever. If at all this normal cell has been exposed to stress, it's going to what? It's going to adapt. And then we looked at those different methods in which this cell is going to adapt. Hyperplasia, okay, metaplasia, okay, hypertrophy. We looked at those different terms. But what we want to talk about here is to say, what if this cell fails to adapt here? It's written inability to adapt. What will happen? Then the cell will end up being what? Injured. And you can see it's written cell injury. And sometimes I want to caution you, you should understand that sometimes a cell can move directly from not even adapting, just direct from a normal cell to being injured directly without having to undergo cell adaptation. It's possible. For example, if someone just pours acid on you, do you think your cells will start adapting? No, they will not. They'll just go directly into what? Cellular injury. And you can see this arrow here pointing straight to cell injury. So when we talk about this cell injury now, you must understand, for example, I've always, told you the importance of somebody that is doing these programs to understand how a human cell looks like. You must understand that from that basic cell that you have, you get to form a tissue. From the tissue, you get to form an organ. From an organ, you form systems. But if you talk about the actual cell itself, it's written to say, before actually the actual cell is injured, they are what we call subcellular alterations. It's written here, subcellular alterations. What do I mean when I say subcellular alterations? Within a cell, you find specific organelles. For example, you find the mitochondria, you find the lysosomes, the nucleus, the Golgi apparatus, the liposomes. You find all those different organelles in there. So before the actual cell as a whole is damaged, there are certain things that happen to these different organelles first. So for example, if at all the mitochondria has been damaged, we're going to refer to that as subcellular alteration because something within the cell, a subunit of the cell has been altered. So we call it subcellular alterations. So before the actual cell is actually injured, a student doing this course must understand that things start from first injuring the actual organelles. You injure the cell membrane, you injure the mitochondrion, you injure the lysosome, the nucleus. At the end of the day, the cell will end up, getting injured as a whole. So from subcellular alterations, that's where now you go to what we call reversible cell injury. As we explore this particular video, you get to understand that there are two different types of cellular injury. There's what we call reversible, in which if at all you were to remove the stressor, or if the damage is not too much, you can reverse the injury and things can go back to normal, right? But there's what we call, it's written there, point of irreversibility. So there's what we call irreversible cellular injury, whereby the damage is just too much and you can't reverse the damage. And the cell from that particular point will just end up dying, okay? So that is the picture that I want you to understand. Let me just run it through again. We said we move from a normal cell. From a normal cell, if this cell is exposed to stressors, it can adapt. If it fails to adapt, it will be injured. Cell injury there. And you must understand that cell injury starts from subcellular alterations. alterations faced in the actual organelles. Then from there, it reaches a point whereby the actual cell now has been injured itself. And then depending on the severity of the injury, it will depend if at all we can reverse the injury there, as you can see, reversible cell injury, or it cannot be reversed, which we call reversible cellular injury. And from there now, the cell will end up dying. It's written there, necrosis dying. Necrosis down there. Necrosis is just one of the processes that a cell gets to die. There's what we call necrosis, which is usually pathological. It has to do with a disease being present. Then there's what we call apoptosis. Apoptosis is different from necrosis. Why? Because apoptosis is a programmed cell death. I'll get to explain how this comes about. It's not that there's a pathology, no. It could be maybe that the body itself has decided to program this cell to be able to die on its own, maybe because it has been infected by a virus, or maybe because it has got some sort of precancerous, cells in it. So I took time to explain those different concepts because as we make progress, I want you to be able to follow through properly without having a challenge. So we're saying that cell injury and cell death are fundamental processes that underline the pathogenesis of nearly all diseases. I did indicate to say most of the diseases that we see existing are a result of the cells being injured and the cells ending up dying. Why must you start sneezing? If at all you've been infected by a virus, why must you start producing pus from a wound if you have been infected by something? Or there's maybe a medical agent or something that is affecting your tissue. It's because your cells at that particular point will be injured, and when they're injured, they'll end up dying. When they die, they'll start presenting all those various symptoms that we see that of course just interpret how a disease is taking place. That's pathogenesis, right? And then we're also saying that when cells are exposed to stressors beyond their adaptive capacity or to damaging agents, they undergo structural and functional changes that may be reversible or irreversible. So when these cells are exposed to stressors, it could be too much exercises, it could be maybe the smoke, it could be the heat. Those are stressors. If the stressors are too much and these cells fail to adapt, they will now be what? They will now undergo structural and functional changes. And we're talking about now the cell actually being injured here because it has failed to adapt. It has failed to withstand that smoke, that fire, all right? Maybe that heat, or maybe that particular force that you're applying on it. And then you find that it will now start modifying itself in having to change in its functional and structural elements. And then we're saying that depending on the severity, it will depend if at all this injury now, it can be reversible or irreversible. And then we're saying that understanding the mechanisms of cell injury is crucial in clinical medicine. You have to understand, if at all I'm saying that this cell has been injured, in what way has it been injured? Because even when we give treatment, we look at treatment in those lines. If at all this body part has been affected, in what way is it being affected? Understanding pathology even helps you to understand pharmacology. Because if you know the ways in which this cell is being challenged or injured, even you finding a proper pharmacological approach will be easy for you. Because if you understand that if it's the mitochondria being affected, then maybe if I give this particular drug, it's going to boost in this particular manner. So we're saying that understanding the mechanisms of cell injury is crucial in clinical medicine as it explains how diverse insults. When I say insults, I simply mean that anything that can trigger cell injury is called an insult in medical terms. Anything that can trigger cell injury is called an insult. It could be a biological insult. It could be maybe toxins, toxic stuffs, all right? It could be anything that is just going to cause or trigger cellular injury, call it an insult. So we're saying that understanding these different mechanisms of cell injury explains how these insults, such as hypoxia, that is low oxygen, toxins, infections, and indeed genetic abnormalities lead to disease. So when you understand how the cell is going to be injured, you even get to understand how it's going to lead to a disease. For example, they've given an example of hypoxia, that is low oxygen levels. How will now low oxygen levels lead to a disease? I'll get to explain those things very soon. The general objective of this particular class is that you should be able to understand, or gain knowledge on cell injury and cell death. That's what I want you to be able to, acquire at the end of the day. Then the specific objectives are that we're going to first define the key terms related to cell injury and the cell death. Number 2, we are going to state the causes of cell injury. Then number 3, we're going to describe. See, the first thing we're going to do first is we will define the key terms that we must understand in describing the cellular injury and cell death. Then we're going to talk about the causes of cell injury and cell death. Then now we're going to describe, if at all I've got the cause, in what way is this cause damaging this particular cell? Those we call them mechanisms of cellular injury. Then we're going to outline the types of cell injury, and then last but not the least, we'll talk about the cell death. So I'm recording this particular class so that you find time to go through it as many times as possible so that you can, acquire the much needed information that you need to be able to attempt any question that is related to this particular topic, right? So let's make progress. So to start with the key terms, we'll talk about the actual cell injury. What do I mean when I say cell injury? So cell injury is any damage or alteration in the normal structure and function of a cell that is resulting from where? It could be exposure to harmful stimuli or inability to adapt to stress. That is what we call cell injury. When the cell has been injured, we are saying that this is any damage or any alteration, not just in the structure, but in also the function of the cell that is coming from or as a result of harmful stimuli. When I say harmful stimuli, it could be a pathogen, it could be a toxin, it could be a bad chemical, okay, in those lines. And making this cell unable to adapt. So cell injury is any damage or alteration in the normal structure and function of the cell resulting from harmful stimuli or inability of the cell to do what? To adapt to stress. Then when I say cell death, look at these differences. You can see that cell injury, we're talking about the cell having to be injured, but not talking about it dying. But when we say cell death, we're talking about permanent cessation of all cellular functions occurring either through apoptosis or necrosis. The same way we talk about death, to say death is the cessation of all physiological functions. You apply the same concept in line with the cell. When you say cell death, you simply mean that you're talking about permanent cessation of all cellular functions of physiology occurring through apoptosis and necrosis. When a cell is dying, students take note that a cell can die in two different ways. It can either die through apoptosis, which I have already been saying to say this one is programmed. The body programs a cell to die. It tells it to die. Not that the cell wants to die. But in necrosis, it's a different case. There is some sort of pathology or disease that is making this cell to die. Even if there is no way out. It's not like the body is programming the cell to die. Even if the body is not programming the cell to die, the cell will end up dying because there's a pathology. That's what we call necrosis. There's a disease somewhere. Okay? Then when we say apoptosis, this is a controlled, programmed process that eliminates unwanted or damaged cells without inflammation. Right now, as I'm speaking, my body, for example, maybe there's maybe a cell that has been infected by a virus, and then once my body notices it, it's like, I'm going to get rid of this because it's dangerous. So it's not that maybe I'm going to experience any signs and symptoms in this particular manner. No. The body will just decide to kill any cell that looks strange, any cell that is unwanted or damaged by something without causing inflammation. It's programmed cell death. But when we talk about necrosis, you can see this one is an uncontrolled process resulting from severe injury that is characterized by swelling, membrane rupture, and inflammation. So when it comes to necrosis, you will be able to see the signs and symptoms from your patient because it's a disease, it's a pathology. It's a type of cell death that results from a pathology and it is characterized by the following features: cell swelling, membrane rupture, and indeed inflammation. All right, so these are the important terms that I wanted you to understand. Then let's move on, students, and look at the causes of cell injury. What are those things now that will cause injury to the cell? We've already said that cell injury is any damage or alteration in the normal structure or functioning of the cell resulting from these things we're going to talk about. So the causes of cell injury, they are categorized in two main factors or in two main elements. They are what we call genetic causes. Genetic, it simply means that these causes of cell injury were not acquired by a person, but they are inborn. They could be inherited. Defective genes, for example. You find that, for example, someone is born with defective genes that make cells to be growing abnormally or injuring themselves. Those things are inherited. And then there are what we call acquired causes, for example, pathogens. You are not born with a pathogen, right? You are not born with a bacteria that is going to give you flu. You are not born with a virus that is going to give you hepatitis. So those things are called acquired causes, because naturally those things are not in you unless you get them from someone. So we call them acquired causes. That is in a broad manner. But if we were to look at things specifically, these are the causes of cell injury. Number one, hypoxia and ischemia. Hypoxia and ischemia. Now, I want to take time and explain these terms because hypoxia and ischemia is the most common cause of cell injury, hypoxia and ischemia, these two. Now, I'll start with ischemia. What does ischemia mean? Ischemia means blockage of blood supply to a specific body part. Okay? Others, they just like calling it blockage of perfusion or lack of perfusion to a specific body part. So when you say ischemia, what you mean is that blood supply to a specific area has been blocked. Now, how does hypoxia come in? Hypo meaning low, right? Oxia, oxygen. So when you say hypoxia, you're talking about low concentration of oxygen. But as a student in a health program, you must understand that if you say, for example, about ischemia, if you say ischemia is the blockage of blood supply, you ask yourself, what is it that is carried in blood? It's oxygen. So it is ischemia that results into hypoxia. What comes first is ischemia. If at all a specific body part has been blocked, meaning blood is not going there, meaning there will be no oxygen to that particular area. So one of the causes of cell injury is ischemia and hypoxia. We are saying that lack of oxygen or blood supply is the most common cause of cell injury, seen in conditions such as myocardial infarction. Myocardial infarction is what we call heart attack. In layman's language, we call it heart attack. Okay? So when you say hypoxia and ischemia is going to cause heart attack, what do you mean? For example, students, I remember when I wrote my test 1 in pathology, a question that came was us having to explain how this ischemia is going to lead to a heart attack. How? The process. So number one, I understand that talking about myocardial infarction, that is the heart. Remember, in human anatomy, you learn that the heart has got different layers. It has got the epicardium, the pericardium, the myocardium, and the endocardium. I'll just pick one specific part, which is very, very special. That is the myocardium, the thickest layer of the heart. Now, that thickest layer of the heart has got heart muscles. Those heart muscles, they are the ones that, of course, generate action potentials that brings about contraction and relaxation of the heart. Now, when you say myocardial infarction, what you mean is that blood supply to those heart muscles has been blocked. You understand that the coronary arteries, they're the ones that supply blood to the heart. So when you block blood supply to those muscles, they're the ones that bring about heart attack. And how does this, come about? For example, if I told this coronary artery that is supplying blood to the heart muscles has been blocked, maybe due to maybe an embolus, or maybe a thrombus, maybe an atherosclerotic plaque, or cholesterol plaque, it has been blocked. When you block blood supply, what happens is that you know that oxygen is needed to perform aerobic respiration. That brings about formation of ATP, right? That is biochemistry. So the heart muscles need ATP for them to contract, right? Now, imagine you block blood supply to these heart muscles, to these cardiac muscles, to these myofibers. You must understand that there will be shift of the biochemical pathway from aerobic respiration to what we call anaerobic respiration. Anaerobic respiration, you are talking about having to continue glycolysis, okay, in an anaerobic manner in the absence of oxygen, which brings about lactic acid buildup. Lactic acid or lactate is acidic in nature because of the hydrogen protons that it contains. When these things build up, when this lactic acid build up within these myofibrils, they get to be acidic. You make that environment very acidic. It brings about what we call acidosis, right? So it will start burning the tissue, and then the cells will end up dying. Now, if the cells die, it simply means the tissue is going to die. If the tissue dies, well, don't you think that particular organ of the heart is going to die? Well, it will die. Because now the cells have died, the tissue has died, it's the organ has going to die. If the organ has died, well, students, where will the muscles that are supposed to pump blood come from? You see, that's how now a heart attack comes in. So somebody will be failing to pump blood. Why? Because those muscles have been compromised. They can no longer pump blood because they have been injured. If anything, I may explain this process in a long manner like this, but this happens in a very short period of time. Less than 10 minutes, everything I've talked about here has happened. And somebody can end up having what we call cardiac arrhythmias, which are very, very terrible stuffs that cause, of course, human death. Someone will stop being alive. I was taking time to explain these things because most of other causes, they usually find themselves in line with this at the end of the day, bringing about hypoxia and ischemia. So it's very, very fundamental that you understand how hypoxia and ischemia brings about cellular, injury. Okay. The other thing is exactly what I was explaining here. This is hypoxia and ischemia. I was explaining what was happening in the heart. So just follow the diagram and then you understand this stuff. Physical agents. When I say physical agents, I mean in a broad manner. There are a lot of things. Okay, it could be trauma, direct trauma. Someone was involved in a road accident, they were bashed, okay, maybe they were slapped, maybe they were punched, maybe, they had a laceration wound. All those kinds of trauma, they do cause cell injury. Why? Because if you look at this particular wound, for example, is this how a human being looks like normally? No. Because these cells were traumatized, they were stripped off, they were injured, things were being cut through them. That's why they're looking like this. So that is it. Physical agents, for example, can just say trauma, radiation. Some of you would understand how does radiation cause cellular injury. You've heard of people that if at all you are overly exposed to radiation light, okay, or radiation rays, you get to be predisposed to cancer. Here's the basic stuff. So those radiation rays, if you look at them, they are those gamma, beta, alpha rays that get to penetrate within the integumentary system, the skin, right? Now what happens is this. If these rays, they are too much into these cells that line up the skin, the melanocytes, keratinocytes, they get to mutate the genes that make up those cells. So if these genes were to be mutated, they start growing abnormally, bringing about those melanomas, the skin cancer, because these genes were too much, like they were overly exposed to sunlight. At the end of the day, they ended up mutating. Maybe they were trying to adapt. Maybe they were trying to withstand the sunlight. And then now you understand that if these genes undergo mutation, even the cell nature is going to change. It no longer looks the same, bringing about dysplasia, which just is a hallmark of cancer stuff. You can see there, these are some of the somebody being burned by the sun. You can see even extreme temperatures like water, fire. All those things are physical agents that can traumatize or bring about, cellular injury towards these particular body tissues. Okay? Then chemical agents. I can talk about this a whole day. But what you must understand at chemical level is that when people take drugs, they take insecticides, they take pollutants. Sometimes pollutants is not even taking willingly, but maybe just being exposed to them. What happens is that, you must really appreciate physiology. When these things are inhaled, taken, or indeed maybe put on a specific body tissue, they get to invade different organelles within the body. When I was teaching you biochemistry, for example, if I talk about drugs, I mentioned to say, if you are talking about electron transport chain, when you look at that chain, there are specific complexes or coenzymes that you find within that chain that facilitate the production of ATP. I talked about coenzyme Q being inhibited by doxorubicin. It's one of the chemotherapy drugs that we give to patients. Now, you must understand that that's a drug, right? So if that drug is being given to this patient on a daily basis, they're just being given doxorubicin, and then doxorubicin is inhibiting ATP production. You must think critically. If ATP production has been inhibited, the body will not have enough ATP. And as an educated nurse, you just don't end there. When you say the body is lacking ATP, what exactly do you mean? You understand that in this particular cell, in this particular human cell, there is what we call a cell membrane. This cell membrane is lined with various pumps that sometimes, not just those that depend on proteins, but sometimes those that depend on ATP. For example, the sodium potassium channel pumps, they need ATP to maintain the influx of calcium, the efflux of potassium, the influx of sodium. They need action, potentials to be able to maintain those things, which need ATP. So if ATP has been, disrupted in terms of its productivity, you understand that those pumps will be compromised and things will just start entering the cell and leaving the cell. That swelling that you see in a patient, their wound is producing too much pus. You must understand that the membrane potentials, they have been compromised at that particular point. Things are just leaving and entering the cell anyhow because there's no ATP to balance those things. Coming from where? As simple as someone taking a drug that is disrupting ATP production. Some of these chemicals that we take, they get to inhibit a lot of enzyme expression, hormone expression, just inhibiting a lot of things at the molecular level. As a result, they end up damaging the actual cell. And you must always remember, if a cell has been damaged, a tissue has been damaged. If a tissue has been damaged, then the organ has been damaged. So chemicals, it could be drugs, it could be insecticides, pesticides, pollutants. These, they can also cause cellular injury. Biological agents, viruses, bacteria, fungi, protozoa, parasites, all these things are foreign to the body. They trigger an immune response. This is why I find that when someone has been infected by a bacterium on whatever part of the body, parts will start coming out. It's a worm, hematode, parts will start coming out because those things are causing damage to the cell and they'll trigger an inflammatory response. Nutritional imbalances, malnutrition, look at it from different angles. For example, I'll give you one side. When I say malnutrition, I simply mean that, for example, somebody is not eating well. If somebody is not eating well, they are lacking ATP. If they're lacking ATP, what does ATP does? ATP is needed to maintain membrane potential. So if there's no ATP, the membrane, channel pumps have been compromised. They'll just allow things to enter and things leave. Get it? They're going to cause cellular injury. So those are some of the common, common causes of cellular injury. Allow me to talk about the last cause of cellular injury that I want to stress much emphasis on, and those are free radicals. Free radicals. In secondary school, you were taught that a radical is any molecule or atom indeed that has unpaired electrons in its outermost shell. So if these electrons are unpaired, then it makes this molecule very unstable, very, very excited because it wants to stabilize itself. It's very, very reactive because in its outermost shell, the electrons are unpaired. So it will try by all means to look for whatsoever it can look for and get that one electron that it wants so that it can become stable. Everybody in life wants to go towards stability. Even you, if things are not fine, you want to try by all means to source whatsoever you can so that you can become stable. Even those molecules, they do the same. But if you talk about how they do it now at molecular level, they get to cause cellular injury. We're saying that free radicals are molecules with unpaired electrons, for example, superoxide, hydroxyl radical, hydrogen peroxide, nitric oxide. All those are radicals. If you look at their outermost shell have got an unpaired electrons or an unpaired electron. So they will be trying by all means to look for whatsoever molecule, protein, enzyme, or lipid near them to just react with it. They have got high affinity for other molecules so that they can just pair with them and they become stable. But the problem is that as they are doing that, for example, if I've got hydroxyl radical, it's roaming around in the body, within the body tissues. If it gets to target, for example, the phospholipid barrier, the cell membrane, it's going to start reacting with those bonds that make up the phosphate groups, the hydrocarbon chains. If it's reacting with them at a molecular level as a student, you must think it's breaking bonds. It's breaking chemical bonds. So once it gets that electron from the lipid bilayer, it gets to itself, so it becomes stable. The lipid bilayer becomes unstable because it will also lack that electron. So that particular part affected, it will also try to affect another phospholipid so that it can become stable as well. Once it does that, it leaves that other lipid unstable, and then the channel it will continue. It's like you steal something from somebody. It's written there. How do these free radicals react? Because they are unstable, they steal electrons from nearby molecules. It's like if they steal electrons from a nearby molecule, that molecule remains also unpaired. It will also want to steal electrons from another molecule. That one again is going to steal another one. You find that the whole membrane at the end of the day is damaged because each one is trying to steal. So you can see that the presence of these free radicals in the body, they are very, very bad. They cause cellular injury. Why? Because what I was explaining, especially in lipids, is what we call lipid peroxidation. You find that free radicals will start attacking the cell membrane, having to break the bonds within the phospholipid bilayer, and then damaging the cell membrane. You will learn that if the cell membrane is damaged or compromised, things will just leave and enter the cell. Well, the cell will be injured in that particular manner. Okay? We are saying that what do these free radicals target? They target the lipids, they damage the membranes, I've explained. If I've got this free radical around the cell membrane, it will start reacting with the phospholipid bilayer, getting electrons from them, breaking bonds, things start leaking out. Proteins, it can react with the proteins and change their function and enzyme activity. DNA, imagine a free radical reacting with the DNA. That is total mutation at hand. Because DNA is a molecule. Should it get its electrons and donate to this free radical, that DNA molecule has become compromised. It will be subjected to mutation. And once there's gene mutation, even the cell being produced will be abnormal. The cell has been injured. What is the result? This uncontrolled chain of reaction leads to cell injury, dysfunction, or cell death. You can see, for example, if I've got a normal cell that is here, if this cell is surrounded by free radicals, they'll start breaking down the phospholipid bilayer, compromising the cell membrane, things leaking out, and then the cell is going to end up with what you call oxidative stress. Oxidative simply means removal of electrons from a molecule. So oxidative stress simply means that this cell is being stressed as a result of it having to lose electrons going to free radicals, or free radicals removing electrons from them. In my next video, I'm going to continue and talk about mechanisms of cell injury. Now we have talked about the causes of cell injury. This can cause cell injury, this can cause cell injury, this can cause cell injury. But in the mechanisms, we want to understand in which part of the cell exactly is going to be hindered. In what way will this cell now be, injured so that it can now end up dying? Is it ATP depletion? Is it the mitochondria? Is it the cytoskeleton? Is it the nucleus? What exactly is being targeted? or what exactly is being injured by this cause for this cell to die. Those are the things that we're going to talk about in the next video. Please remember to subscribe to this YouTube channel. Encourage your colleagues to subscribe as well, because here we get to explain, here we get to give you the details that you need to pass that exam or to pass that particular test. See you in the next video, and all the best.